Bethany. I am the student nurse here for you, closing the curtain for privacy. How are you this morning?
I'm good.
Okay. Alrighty. Will you tell me your name and date of birth, please? Alright, Miss Martha May, birth date 9/12 of 1949. Alright, Miss Martha, so this morning, like you probably have had in the past, we're going to do your medications. Is it okay if I do that with you at this time? Okay, I'm just going to get you sit up here to give your medications. Is right there okay? Okay, let's get that down. All right, Miss Martha, so first on the list here is your fluoxetine, which is for your depression. All right. Have you had dry mouth with taking the medication? Okay, because I know sometimes it can cause dry mouth, so I'll just make sure or have on hand some water for you throughout the day and maybe some gum or candy to keep that mouth moist. All right, so here's fluoxetine, 60 milligrams, and it's 3 capsules for you. And here's some water. And do you do okay swallowing? Okay, and there's your pills. Okay. All right, now we're gonna look at your insulin. Your insulin is 2 combined that I have for you. It's your Lispro and NPH, your fast-acting and intermediate. Is it okay if we do it on your abdomen? Okay. All right, so let's have your abdomen, have that in view. And I can compare to the MAR where it was last time, located in alternating locations. We'll clean for 20 seconds in circular motions, inward to outward. Okay, we'll let that dry and confirm that your insulin is in this vial here, your insulin NPH 10 units comparing with the MAR, and your Lispro is 2 units. Okay. And your insulin is for your diabetes. Does that sound correct? Okay, and we're just gonna probably check your blood sugar throughout the day and maybe alter the dosage and talk with the provider if any changes need to be made. All right. Okay. All right, and I could have a cotton swab if needed, and we'll go at a 45-degree angle. All right, 1, 2, 3. Keep it in there for 10 seconds. Make sure the insulin is there. Okay, I put on my safety, discard in the biohazard or sharps container. All right, so now we're going to give you the ceftriaxone, which is for your urinary tract infection, and it's going to go in, it's your larger muscle for your antibiotic, and depending, we're going to have you finish it for 5 days, so the antibiotic is most effective when we finish it all. Have you had a rash, sore throat, or itching? Any signs of an allergic reaction? Okay, good. That's good to know. All right, and do you have a preference of which side? I'm going to give this on your hip muscle, your ventrogluteal. Okay, we'll do it on your right side here, and I would like to have you turn on your side, your left side, and we're going to feel for the top of your iliac crest and feel for that, noting the V location, having a pinpoint spot. Okay, let's get that clean for you. And your ceftriaxone is 0.5 milligrams. Okay, we're gonna clean that there. 20 seconds, circular, inward and outward. Okay. And that's always with the new alcohol pad. This one I would like a cotton ball and a Band-Aid. All right. This one's gonna go at 90 degrees. And we're gonna go, and I can use the Z-Track method. Pull the skin back a little bit. All right, here we go. 1, 2, 3. All right. Okay. Put the safety on. Cotton ball Band-Aid. And sharps container. Okay, how are you feeling? Okay, and we're gonna give you your cyclophalmazine, which is your vitamin B injection, which you're low in that vitamin, you're deficient in vitamin B12, and that could be because of your diet, you're not, or nutrition with meat or eggs, so we're gonna give that injection to you. And it's 200 microkilograms, and we're gonna give this in your deltoid muscle in your arm. Do you have a preference of which side? Okay, we can still work on this right side. Okay, all right. Okay, new alcohol wipe. We're going to go here. Okay. Cotton ball and Band-Aid is on hand. All right, 1, 2, 3. Okay, safety, Band-Aid, cotton ball, Band-Aid. Alrighty. Okay, we have one more medication, we're gonna do a tuberculosis test, which is a pure protein derivative, and tuberculosis affects your lungs and your immunity, so we just want to check and make sure everything is okay there. Do you have any questions? Okay, all right, so we're going to see your forearm and compare sides, look at tattoos, any moles, any skin color distortion, tattoos. All right, so do you have a preference, or I can choose or look at what side? Okay. Alrighty. And this is tuberculosis. Alright, so, and for this tuberculin test, we're gonna come back in either 48 to 72 hours to check for induration, and that just means you had a positive reaction, and we'll have you be treated. Alrighty, okay. So, and we won't put any Band-Aid or swipe it or try to irritate it, and try to leave it alone so it is just there to be effective. Okay, we'll let that dry. Okay, with bevel up, tone the skin. All right, we got our bleb there. Okay, and sharps for that. Alrighty, so take out some gloves, hand sanitize. Alright, Miss Martha, how are you feeling? Okay, so also with that fluoxetine, I forgot to add, does it make you feel drowsy? Okay, because sometimes it can, and we can talk to the provider about maybe possibly switching it to the afternoon if it makes you drowsy. Do you have any other questions about your medications? Okay, so everything looks good. I'm going to clean everything up. Is there anything you need before I leave? Okay, and after leaving the patient's room, I'm going to document how the patient tolerated injections and note the location of where I administered the injections, and especially make a note to have the TB test checked on. And I believe that is it. Thank you.